Hello everyone, this is Dr. Brenda John with another video. Today I'm going to talk about the Neuro Developmental Disorders Treatment. The treatment for neurodevelopmental disorders depends on the specific disorders and its severity. There are some possible common treatment options. The first option is a behavioral therapy. Behavioral therapy can be effective for treating neurodevelopmental disorders, spectrum disorders, and ASD, attention deficit hyperactivity disorders. Behavioral therapy can be helpful for individuals who develop coping mechanisms and improve their social skills and manage symptoms. Speech therapy can be helpful for individuals with language and communication difficulties, such as those with specific language impairment or stuttering. The third one is occupational therapy. Occupational therapy can be helpful for individuals with sensory processing, like someone has difficulties with motor coordination issues and other difficulties with daily living. So occupational therapists can help individuals to manage their daily living, like such as bathing and then doing all the house chores and then living a normal life. So it's really helpful, and it can be effective for individuals who have any symptoms of ASD, ADHD, any other disorders. Education and support for individuals and families can be helpful manage the challenges associated with neurodevelopmental disorders. Support groups and educational programs can provide resources, guidance, and emotional supports. So it's really important to encourage the individuals to join any type of resources are available that can help them and then educate them so they can manage their daily living. Early intervention is an important for neurodevelopmental disorders such as autism spectrum disorders, ASD, and developmental delays. So early identification and treatment can help improve the outcomes and quality of life for individuals with those disorders. So it's really important for the parents to recognize if their kids have any abnormal symptoms. So please take them to a specialist, take them to a doctor so they can find out what's going on with them and help them to identify early interventions that can help them improving their lifestyles. Medication can be helpful in managing symptoms of some neurodevelopmental disorders such as ADHD and tic disorders. So, however, medication should be used under the guidance of a healthcare professional. So, always seek for a professional guidance, because these symptoms can get worse if not treated by a professional healthcare. And it is important to note that treatment for neurodevelopmental disorders should be individualized and may involve a combination of these approaches. So, a healthcare professional or a therapist can help identify the best treatment options for any individuals with specific needs. Thanks for watching. Stay tuned till next video.